Hello, my name is Dr. Aashish Contractor and I am a preventive cardiology and rehabilitation specialist. A question that people often ask is that which test should we do? Because doctors say do an ECG, some say do an echocardiogram. Let me tell you a little bit about each of these tests. So the first is an ECG, or in the West sometimes people call it an EKG. It's an electrocardiogram. Essentially it's a recording of the electrical activity of your heart, and it gives you a fair bit of information, but it doesn't give you everything. So for example, it can give you information on the rhythm of your heart. Is your heartbeat steady? Is it regular? Are there missing beats? Are there extra beats? It's also an excellent test to do when you're actively having chest discomfort, and it can tell you whether you're having a heart attack at this minute or not. So that's an ECG. Another one is a stress test. A stress test, what it does is it takes your ECG and then it gets you on the treadmill or on a cycle and makes you exercise and keeps making the exercise harder and harder. So in effect, the exercise is stressing your heart. And then we're looking at how the ECG reacts while your heart is undergoing this stress. Therefore, we call it a functional test. It's actually looking at how your heart is reacting. Now, on that test, if your heart is getting a compromised blood supply, it can show up as changes on the ECG. Another is a 2D echocardiogram, or we call it a 2D echo in short. This talks to you about the pumping of the heart. It can tell you how well the heart is pumping, how much blood is pumping out in every beat. It can also tell you the functioning of your valves. You have 2 or 3 important valves in your heart which control the one-way flow of blood, and looking at the echocardiogram, the functioning of the valves can also be ascertained. Another test is the angiogram. Now what does an angiogram do? And often we do a CT angiogram, which is the same thing done in a CT scan machine. It looks at the inside of your arteries. There are 3 main arteries which supply blood to your heart. Your left anterior descending artery, your left circumflex artery, and on the right side is called the right coronary artery. So the angiogram looks at the inside of the artery. So in many ways it's what's called a structural test, an anatomical test. The stress test was a functional test. The angiogram is a structural test. So when you do an angiogram, and if the doctor finds there are blockages, they then quantify the blockage. You often heard people say, he had an angiogram and in 2 arteries there were blockages, or in 1 artery there was a 90% block, in another there was 70, third artery there was 100%. And then the decision is made almost like a judge passing his sentence on whether we do nothing but regular medical management, or we do an angioplasty, or we do a bypass surgery. And there aren't easy answers to decide. I will shed some light on it, but please remember this is just a rule of thumb explanation, and ultimately each case is different, and your doctor who does the procedure and who knows your history well needs to decide which is the best course of action for you. So the first thing they may tell you is yes, there are some blockages, but we can manage it with what we call medical management alone. Medical management means giving the right medicine, controlling all the risk factors, controlling sugar, controlling blood pressure, controlling your lipids, not smoking, exercising regularly, eating correctly, taking care of your weight. So all that needs to be done. This frankly needs to be done even if you're having an angioplasty or a bypass surgery. So optimal medical management, as we call it, is a no-brainer. Anybody and everybody ought to be undergoing that. So that's the first option. The second is doing an angioplasty, where the cardiologist goes in and over the wire passes a balloon, opens up the blockage, and then puts a stent inside. A stent is like a small metal cylinder which keeps the artery open and patent. And the third is doing a bypass surgery. This is when a surgeon cuts open the chest and at the point of blockage, or rather below the point of blockage, takes another artery and connects it. So in other words, he's bypassing the blockage. Think of the road where there's a massive traffic jam and you ask people to take a detour. So you're bypassing the traffic jam. Similarly, you're bypassing the blockage. You're not removing the blockage. So when you decide between an angioplasty and a bypass surgery, again, a rule of thumb is if there's a blockage only in one artery, usually, okay, not always, usually you'll go for an angioplasty. If there are blockages in all 3 arteries and they're quite extensive, usually one might select a surgery. But as angioplasty techniques are getting more and more advanced, a lot of the old indications for surgery, today doctors are doing via angioplasty itself. So sometimes you may have a 2-vessel blockage and diabetes and you may decide to go for surgery, or sometimes there may be a two-vessel blockage without diabetes, and you may decide to go for an angioplasty. So honestly, there is no hard and fast rule, and sometimes if the blockages are very extensive, you may find that a surgery or an angioplasty may not be the best choice, and you can again put the person on medical management.